Hi, and welcome to another Integrative Interactive Health free webinar. My name is Dr. Sasha Coleman. I'm the naturopath that's working at Integrative Interactive Health with Dr. Mitchell Lambert. And today we're going to be talking about a really important topic. Between both of us doctors, we've definitely seen it a lot amongst patients, which is just sleep issues and insomnia. So we're talking about the insomnia issue, and we're going to talk about some tips and tools for better quality sleep. Now, the recording that you're watching is not from the live event because we had some technical difficulties. So there won't be any of the interactive parts that I usually have in this presentation, and the question and answer period won't be included. But nonetheless, all of the important information that was presented will be included, and you can watch it back whenever you like. All right. So the topics we're going to cover are the different causes of insomnia. There's various reasons why different people have sleep issues in general, and so we'll talk about some of those. Then we'll discuss some of the things we can do to either help or harm our sleep. So there's certain habits that we have, as we're kind of getting ready for bed, and we're kind of going to discuss why some of them may be more beneficial and why they might not be. Then we'll talk about proper sleep environment, which falls under kind of sleep hygiene, which I always talk about with patients. Just really setting the mood for sleep so that you can have really good quality sleep. And last but not least, we'll talk about the techniques to help improve your sleep quality from various angles. All right, so first the question is, what causes insomnia? And before we get into that, I'm going to actually define what chronic insomnia is. So chronic insomnia is the inability to attain sufficient sleep despite adequate opportunity for at least 3 nights per week for 3 months or longer with negative daytime consequences. And those negative daytime consequences are just like you're not able to wake up, you're not able to get done what you need to during the day, you might have to take frequent naps. So pretty much it's just interrupting your activities of daily living. And so that's what chronic insomnia is. And that's kind of the severest form of what we're going to talk about at the very end of tonight's lecture. But then we're going to start first with just various causes for the insomnia. So to talk about sleep, we have to start off with discussing our circadian rhythms. I think circadian rhythms are something that we very much associate with just sleep, our sleep and wake cycles, but actually it has a lot to do with a number of different metabolic functions that happen in the body. So first, we're going to just break down the word circadian. So circa means about or around, and diem is a day in Latin. So we're talking about cycles or processes that happen around or about every 24 hours. So that's what this image here is kind of depicting, which some of the key functions that our body naturally does at those times during the day. And so a lot of these functions are controlled by something called our suprachiasmatic nucleus in the hypothalamus of the brain. And so what happens is once we get certain signals, external signals like light, for example, to that area in the brain, it then turns on or off certain genes. And those genes then control these different functions that happen in the body. So it helps with things such as our sleep, as you already know. It also helps to control digestive functions as well as different metabolic functions. So we're actually going to just kind of go through a little bit of this image here and discuss some of the things that are happening throughout the day in our body that should be happening naturally. So we will start at 7:30. So 7:30 is a really important point. That is when melatonin secretion stops. So when melatonin secretion stops and we start getting those light signals from either the sun or we get a light turned on, that stops melatonin production, which then helps us to get ready for our day. We get an increase in our blood pressure, we have an increase in energy, and that's what's supposed to help you feel refreshed and ready to wake up in the morning. The next point here at 8:30 is when a bowel movement is very likely. So after our whole resting period during the night, our digestive system naturally wants to then eliminate this waste that we've kind of accumulated overnight. So that's a time that our body usually will have a bowel movement. Next, we'll talk about 10 o'clock. 10 a.m. is the point in the day where we have highest alertness. And so this is really well studied out and really understood because that's why, we usually have school or work start at about 9 so that, by 10 o'clock, you are really being effective in your day because that's naturally when the brain is most awake and most able to do its cognitive processes very effectively. Then we move around to 5 o'clock. So that's the point of greatest cardiovascular efficiency and muscle strength. So if you want to get in a little workout at this time, that's also a great time to do so because we do have really good cardiovascular health at that time. Doing any strenuous exercise kind of after that point, kind of closer to bedtime, is not usually recommended, but around 5 o'clock is a nice time. Like after you get off work, doing a little walk, doing some brisk exercise is a great idea. At 7 o'clock is when we have our highest body temperature. Now, body temperature and just like our environmental temperature have a lot to do with our ability to fall asleep and stay asleep because the body has this spike in body temperature so that during the night it cools down. And as the body is nice and cool, it helps us have a deeper, better sleep. Then at 9 o'clock, this is another very important part in the day, for 2100 hours. That's when melatonin secretion starts. So this time of day, it's very important not to have very many light signals around you. So what I mean by that is, you want to start dimming down lights. You want to turn off the electronic devices. You want to start winding down for bed by 9 o'clock. That's right when, melatonin secretion should really be starting to help you fall asleep very naturally. In the middle of the night at about 2 a.m., that's actually when we should be getting some of our deepest sleep. So by that time, we should have ran through at least a few cycles of, our stage 1 to 4 sleep, including some REM sleep. But this is when we should be getting our really good stage 3, stage 4 deep sleep and REM sleep. And then 4:30 is at the point where we have the lowest body temperature. As I was talking about before, that lowered body temperature helps you really get into nice deep sleep. And then at 6:45, we have that sharp rise in blood pressure. And also at 7 o'clock is when our cortisol starts to increase. So cortisol is another hormone that's really helpful for us to get up and go and get our day started. So with that increase in blood pressure, increase in cortisol, decrease in melatonin, that's what really helps you start going with your day. So disturbances in these circadian rhythms of all these different functions that have to happen throughout the day and night can cause issues with thinking, emotions, and our physical health, which we'll talk about a bit as well. Now, when I say important sleep ingredients, what I'm talking about is the different nutrients, hormones, and things like amino acids that are all involved in the process of helping us sleep. So this image here on the right is a great pathway that, at the end of it, if you look at the very bottom, it says melatonin. And I think many of us have heard and know about how important melatonin is for our sleep, especially the process of being able to fall asleep, especially. So with melatonin, in order to produce it, there are precursors or things that we need before the melatonin can be produced. So to start that off, we'll go from the very top of this picture, starting with tryptophan. So tryptophan or L-tryptophan, as you see it listed on the left, is an amino acid. And this amino acid is very, very important in the production of melatonin. If we don't have that, we're not going to have melatonin production. And you can get this from various forms. They do have supplements of L-tryptophan, but you can also get it from different things like nuts. Turkey's a really good source of tryptophan, and various foods. Now, to the right of them, to the right of the tryptophan in the green box, you see a bunch of different names there. So Fe stands for iron. So we're talking about the mineral iron. And then magnesium is Mg. Ca is calcium. Vitamin B6 is one of our B vitamins, and folic acid, another B vitamin. These are all, you can say, catalysts to the reaction. So tryptophan has to turn into 5-HTP. And in order to do so, you need all of those minerals and nutrients, the iron, the magnesium, the calcium, in order for that reaction to occur. So if you have all those nutrients plus tryptophan, now we're at 5-HTP. 5-HTP then needs vitamin C, vitamin B6, zinc, and magnesium in order for the reaction to turn into serotonin. Serotonin is kind of one of our happy hormones, you know. Serotonin is something that's often produced when we do things like exercise. Sometimes when you eat some dark chocolate, you get a serotonin release. But this is an important precursor as well to melatonin. And if you look to the arrows outside of serotonin with the X's through it, what that's trying to depict is that if you don't have serotonin, you can have various issues such as sleep problems. It can also affect your gut and heart health. You can also have cravings for carbohydrates, alcohol, and certain drugs. And also it can lead to more fibromyalgia and other pain conditions. So you don't want to be lacking in serotonin. Serotonin then produces melatonin. And again, if you don't have melatonin, what that arrow going towards sleep problems is trying to say is that if you don't have it, you'll have sleep problems. So those are the main players in that pathway. But in addition, some important sleep ingredients are also various antioxidants and also your omega-3 fatty acids. All right, so we'll talk about some of the conditions or symptoms that are often associated with insomnia. For one, the endocrine and metabolic processes, as we mentioned before, are heavily impacted by the quality of sleep we're able to get. So when people do have insomnia or even have poor sleep quality or are not getting enough sleep, you'll often see weight gain, obesity, type 2 diabetes, hypothyroidism, because a lot of thyroid and blood sugar regulation is actually happening during our sleep. And so if we're not getting those hours in that we need, those functions can't happen properly. Next, our cardiovascular health. That is greatly impacted by our sleep as well, because during sleep, our body is also regulating different inflammatory processes. And the root cause of a lot of cardiovascular disease, especially, is inflammation. So if we're not getting that rest, it then leads to a lot of cardiac problems such as hypertension, heart disease, or potentially stroke as well. Next, our immune system can be impacted from lack of sleep or poor sleep quality. You can see a lot of impaired immune function because, again, during sleep, a lot of immune regulation is happening. So you need to be able to restore and get your immune system where it needs to be in order to take you through the day. And without that rest, you're not getting it. Hematological, so blood conditions such as cancer, has also been linked to more insomnia. And then various neurological and psychological problems that I think we can easily see, we often see correlated with insomnia, such as neurodegenerative and dementia issues, depression and mood disorders, stress and anxiety, even bipolar disorder and schizophrenia have all been associated with insomnia. Now, here are some different sleep disturbance conditions. So these are things that can be underlying or could be really the root cause of your sleep issues. For example, something like obstructive sleep apnea or central sleep apnea, that can really be the reason why you're not able to sleep because you're having apneic episodes where you're not breathing in the middle of the night and then you're waking up. So that causes just really bad, poor quality sleep because you never get into your deep sleep that you need. Then, you have central disorders of hypersomnolence, which is just where you sleep too much. So things like narcolepsy or idiopathic hypersomnolence and insufficient sleep syndrome are all sort of sleep conditions. Then you can have just a circadian rhythm sleep wake disorder, such as shift work disorder, which is for those that, have worked night shifts for many, many years, or, jet lag from just a flight. Then lastly, here we have the sleep-related movement disorders. Now with this, it's really important to know the cause of your sleep disturbance. Is it because you are constantly moving in the middle of the night? Because maybe that could be due to like a magnesium deficiency, for example. So knowing the root cause will help with the treatment. That's what I'm trying to say. So if you have restless leg syndrome, for example, or periodic limb movement or leg cramps, a lot of times that's due to either like a calcium or magnesium deficiency. That's easily correctable often. Okay, now this part might step on some toes. And honestly, I also have some of these personal vices at times. So don't feel bad, don't beat yourself up. Sleep is just something that you constantly have to tweak and adjust and work at and trying to really get to that optimal sleep time, sleep quality, and everything. So we're going to talk about some things that you may or may not have thought of as helping or harming your sleep. Oops, skipped. Okay, so first we will talk about, sorry. Yes, okay, here we go. So first we'll talk about the things that potentially could help our sleep. Things such as reading a book under some dim lighting before bed is a really great wind down activity. Another idea is writing in a journal that really allows you to get rid of all the events of the day so that when you're ready to sleep, your mind is then a little clearer, because sometimes you lay in the bed reviewing all the thoughts, but sometimes just by writing it down, putting it aside, it allows you then to get into sleep a little easier. Drinking a cup of tea, such as some of the teas we'll talk about later, can really be helpful for those struggling with sleep issues. Light stretching. I do like to do like some light stretching before bed because that can really help you to calm down because you're doing some deep breathing while you're doing those stretches, and that can really help get you into the type of mood that you need to promote sleep. Taking a bath is another great idea. And as I mentioned before, deep breathing, praying, meditating, whatever is going to get you into the most relaxed state, that's a good activity to do. Now for the harming side, the favorite TV show, watching anything either on a TV screen, on your phone, tablet, whatever. The issue with that is the blue light that's being emitted. Blue light has a very special way of keeping us awake. Blue light is not just, there's three main types of light: blue, red, and yellow. And blue is the one that really activates the melatonin production, no, sorry, deactivates melatonin production, I'm sorry, the most out of all the different types of light. So that's why it's so detrimental, really, to be looking at those screens because you're decreasing your body's natural ability to produce melatonin. Rigorous exercise. So we talked about light stretching as helpful, but we don't want to do rigorous exercise because that can potentially be keeping your body temperature up, which makes it a little harder to cool down and fall into that deep sleep. And it may just kind of activate you too much so that it's harder to wind down for bed. Again, you want to aim for anything that's relaxing. Harming, that really late bedtime snack or eating too late. As we get older, I think this becomes more and more evident that you can't really eat late at night or else it will just stay right there and not digest. So our body gives us signs that, this is not really beneficial. So you don't want to eat too close to bedtime. If you absolutely have to have a snack or have to have something, make it very small, very light, and one of the sleep promoting type foods that we suggest, like either a handful of nuts, maybe, or less than a handful, maybe a kiwi, because kiwi is sleep promoting, but we'll talk about some more of those foods later. Wrapping up some emails on a laptop. This, it's really the laptop part that's the issue. And also, I don't know how stressful doing emails for you may be, but if it's stress inducing and if it's really time consuming, you might not want to do that before bed because it's harder to wind down after really doing a lot of that work. Sleeping with the light on, that can be harmful again because a lot of the fluorescent lights are emitting that blue light again. So you don't want to be sleeping in that because it's decreasing your melatonin production again. And, scrolling on social media, as addictive as it can be, again, we're looking at that blue light and it's harming our sleep. So we want to minimize that as much as possible before bed. If you can put the screens away 2 to 3 hours before bed, that's really, really best. All right, so kind of talking about some more of these a little deeper, certain stimulants such as caffeine and nicotine actually keep us up. I think the caffeine most people know of, but the nicotine people might not recognize as much, but the nicotine is a stimulant and it can prevent us from going to sleep easily. The vigorous exercise we spoke about before, you want to make sure that you don't do it within 3 to 4 hours of going to bed at least. Naps late in the day. Now naps, I'll give this caveat. If you have to take a nap, it should be between the hours of 1 to 4 p.m. or at the latest, and they should not be more than an hour. Like, don't sleep from 1 o'clock to 4 o'clock. That's not really good either, because anything more than that and kind of outside of those hours have been studied to be not beneficial for our sleep processes. So, keep it between that 1 and 4 hour and for an hour or less. That can be helpful for some people that are really struggling with chronic insomnia, especially. Large meals at night, we've kind of talked on this. It's not what our body is focused on at the time. Our body is not trying to digest food. It is trying to focus on all the different processes that it needs to do during sleep, from cardiovascular to metabolic and inflammatory. It's regulating enough things. It shouldn't have to worry about digesting our food on top of it. Alcohol at night has been studied as well to really prevent sleep. I mean, you can cut it out from early in the day, it's really best. And then blue light screens, we've already talked about this enough. Things that help, moderate exercise, or if you want to get any vigorous exercise in, you want to try and do it before that late evening time. As we mentioned, naps, as I said before, 1 to 4 p.m. no longer than an hour. And if you're going to have a snack, it should be a small, sleep promoting nighttime snack. Okay, so sleep aids. Sleep aids are a huge um, variable to talk about because I know that many people do utilize them. And so they can be useful, they're very effective. It's just good to know the pros and cons of being on it. And, studies and research have shown that sleep aids can be helpful, but in terms of chronic insomnia, you don't want to be on them for really prolonged times just because they do tend to lose their effectiveness and you don't want to develop dependencies. So these are the main classes of drugs that we'll talk about. So the benzodiazepines, then sedating antidepressants, melatonin-based products, and natural products. Okay, so first the benzodiazepines. What they do is they promote a neurotransmitter called GABA. So GABA is just one of our neurotransmitters that help us to get into a very relaxed state. So some of the trade names that you may be more familiar with are things like Lunesta, Imobane, Starnol, Ambien or Sublinox, Intermezzo, and Restoril. So if you're on any of these, those may be the names you're more familiar with. So the pros of them are that they do usually work very immediately. They're very good effectiveness. They have very good effectiveness. And they may be prescribed after something like a grief or a loss, a stressful situation that you may have gone through, adjusting to a serious medical condition, or if you've had like a recent divorce or breakup, because a lot of these stressors can really impact your sleep. And the issue with them is that if you kind of stay in that acute stage of insomnia, then that's usually what that will lead to chronic insomnia. So you do want to try and get out of those. You might need this assistance during this acute stage of insomnia after something like this. Then the cons. So there is a risk of tolerance. And what tolerance means is that at a certain dose, it will work for a time, but then after time, you have to increase the dose in order to get the same effect. And so that's what you don't want to get into because then you just start going, increasing your dose, increasing your dose, increasing your dose, right? And we're not really getting to the root issue here and correcting your sleep. So some of the side effects of these benzodiazepines is that you can have dizziness, lightheadedness, drowsiness, trouble walking straight, memory problems, increased risk of driving accidents, and morning grogginess. So these side effects are especially a problem for the elderly population because as you age, you already start losing things like balance and stability. And so, with a certain medication, you may have that even worsened. And so, that just increases your risks of slip and falls and breaking bones. And that can be really bad for elderly people. So, you also want to take note that these side effects can be worsened by alcohol. So you never, ever, ever want to take sleeping pills with alcohol because what they do is they can potentially depress your respiratory system so to the point that it leads to things like death. And so you don't want to be on a high dose benzo with alcohol. It's never a good combination. The chance of side effects is higher with longer acting forms and higher doses. So if you're on a low dose of the benzodiazepine, you usually don't have to worry too much about all these like serious side effects. But again, we don't want to just keep increasing and increasing and increasing your dose. Rebound insomnia is also a possibility that you have to look out for after you've consistently been using it. Consistent use, even at over 4 weeks long, has led to rebound insomnia. And what rebound insomnia is that you get insomnia even worse than it was initially. So when you try and just cut off of it right after 4 weeks of use potentially, you could have worse insomnia. So you have to really make sure that you wean this medication down and that you are managing the person's sleep or insomnia issues while they come down off of these, especially if it's been for a prolonged period of time. Okay, so now we'll talk about the sedating antidepressants. So antidepressants that have the sedative property is kind of what we're talking about here. So trade names of Deseron, Senequin, Elavil, and Remeron. Those are all different forms of antidepressants that also have this action of helping with insomnia. So the pros are that you don't have tolerance issues, just like with the benzos. So that kind of is a benefit of it, but it's really also great for people with both depression and insomnia, which oftentimes go hand in hand. So trouble sleeping with depression is very, very common, and this can be helpful for that. The cons are that there's little to no research on whether the drug is as effective as at various dosages for people with insomnia that don't have depression. So it's not really been very well studied out for prescribing it just for insomnia alone, as opposed to insomnia with depression. It's really just known its effectiveness with both at the same time, depression and insomnia. So there's little to no research on the safety to use it for insomnia alone, pretty much. Some of these side effects include things like drowsiness, dizziness, confusion, blurred vision, dry mouth, constipation, urinary retention, weight gain, orthostatic hypotension, and heart rhythm problems. So there's definitely more risks than the benzos. So that's what you have to be more wary of with the sedating antidepressants. Next, we have the melatonin-based products. So as you said before, melatonin is that hormone that's released from the pineal gland that helps to aid in our sleep. So trade names of this are melatonin. There's also a prolonged release melatonin and a Ramelteon. Those are all different forms of synthetic melatonin. So it's usually used in the elderly that are over 55. It's for people with chronic issues falling asleep in the beginning of the night. So I kind of touched on this before, that melatonin is really important for helping us to fall asleep. It doesn't have as many side effects as the benzodiazepines or the antidepressants, which is great. Cons of it are that the immediate release seems to be helpful for short-term insomnia. So only insomnia after 1 or 2 weeks, maybe something like jet lag, for example, but not much for chronic insomnia. So that insomnia that's kind of lasted for anything more than 3 months. So prolonged release has not been studied across different age groups, and it's not available in many countries. And then lastly, it mimics a natural hormone, and the problem with that is that studies haven't been done to see kind of the downstream effects of it. So the effects that it has on the different biological systems. So we really have to get more research done on some of these natural products. Then our natural products, such as botanicals or nutrients to aid in sleep. Some of those are things like valerian, which is a herb, hops, kava kava, lavender, L-tryptophan, like we talked about before, that amino acid. Some of the pros are that L-tryptophan does not have side effects of morning hangover or tolerance. And so that kind of grogginess that you get sometimes with some of the medications, you usually don't get it with L-tryptophan, and you don't get that tolerance issue of, a certain dose not being effective and having to just keep increasing and so on. It's helpful for people with difficulty sleeping who are otherwise healthy usually. So if they don't have any additional hormonal or mental, emotional or medical conditions that are sort of underlying as the root cause to their sleep issue, these natural products are great usually. The cons are that not all herbal products are stringently tested. This is something that kind of applies to various conditions, really, and that's why me as a naturopath, I'm really big on educating patients on making sure that you're getting your supplements from a reputable source that do their testing and do make sure that what they say is in there is actually in there at a therapeutic dose, and really make sure that they are testing and sticking to certain standards so that you're actually going to get the effects you need from your natural products. Next is caution should be taken even with natural products because of things like potential liver toxicity. So kava kava, for example, one of the herbs that I've listed above here, does have that side effect potentially of liver toxicity. So you can't take it at a very high dose for very prolonged periods of time. You should really be monitoring how much of that you're taking and for how long. So you have to be careful, even with natural products. That's another thing I'm always telling patients as well. Then lastly, certain products are not well studied for their effectiveness in treating chronic or severe insomnia. So what I mean by that is that it may require some different additional techniques, which we'll kind of talk about at the end, in order to really manage your chronic insomnia. Because I know a lot of people that have struggled with sleep for a long time and that have tried pretty much every herb in the book, and not been able to see improvements in their sleep. It may be because they have, chronic insomnia that may need some deeper therapy than what we've tried already. Right. Next, proper sleep environment. This is one of like the first things I talk about with patients, which is just sleep hygiene. I have a really great sleep hygiene handout that I usually give out that kind of talks about some of these points to make sure of that we are setting the mood and making sure that we have the optimal environment for sleep. So first point is the comfort of your room. There is the optimal temperature for sleep. As we kind of talked about in the circadian rhythm picture, and a little after that about, you don't want to be too hot before bedtime. The optimal temperature is somewhere between 15 to 22 degrees Celsius, or for my Americans watching, 60 to 72%, 60 to 72 degrees Fahrenheit is really your optimal bedroom temperature in order to facilitate that deep sleep. When our body is too hot, we don't get as much stage 3 and stage 4 sleep, which is our deep sleep stages and REM sleep. So you want to make sure that it's not too hot, not too cold though as well. Then you have to think about even your mattress and pillow. How are you sleeping? At what angle are you sleeping? Some people that may have pain while sleeping at night, it could be due to an alignment issue, like maybe you need to sleep on your side. For some people, you can actually sleep on your back, but for some people that may exacerbate things like sleep apnea. So maybe you have to turn over on your side, and sometimes that will help with things like the snoring that you'll see. So yeah, angle, height, position, all of that can really help improve our sleep quality, making sure that you are in a comfortable, effective position for sleep. Level of noise and light. As we've mentioned before bed, you want a nice dim lighting in the room. You want to try and minimize noise to really just help facilitate that calm wind down that you want to get into before bed. This picture of this bedroom is absolutely beautiful. I love it. It's got the nice dim lighting, nice clean bed that just invites you. It's nice and clean, and the bread is spread. It's just like you're ready to go to sleep. Next, you want to minimize interference from things like your partner, your children, or pets, where possible, of course. Reserve your bed for sleeping. This is a huge point that I always stress with patients, especially if you struggle to fall asleep. You don't want to lay in your bed for more than 20 minutes. If you're laying in there, just kind of tossing and turning, not falling asleep for over 20 minutes, Get out of your bed, do some sort of gentle activity like reading or stretching or breathing. And then once you start to feel tired again, try to lay back down. But don't just lay there consistently because it then creates this negative association with your bed, which then feeds into poor sleep, just continuing on and on. And so you want to only stay in there no more than 20 minutes until you can fall asleep. And then really just take time to relax and wind down before bed. You know, if you can have like an hour, half an hour to an hour of just your wind down period, if you are struggling with sleep, it's very important to be intentional about, blocking that time out to be able to get some good hours in. So those are just some of the activities that we've already mentioned that can help with your wind down. Next, techniques to improve your sleep quality. This is, I think, the part that everybody's kind of been waiting for, the real what you can do things. So these are some of the lifestyle recommendations that I have. As far as sleep scheduling, this is one of the key fundamental things you have to focus on first. Getting into a consistent sleep schedule can really help improve the quality of your sleep. And honestly, quality is more important than quantity. Sorry, that's wrong in the slide. It should say quantity. It should say quality, oh my, quality over quantity. So what that means is that even if you only get, 5 to 7 hours. Some people wake up refreshed and are good off of that, and they don't need like 8 or 9 hours, for example, because the quality of their sleep is so good that they don't need necessarily 8 hours, right? The optimal hours during the night to fall asleep is anywhere between optimal hours during the night is 9 to 12 to try and really get some sleep in. If you can start sleeping before those hours and get those hours included as a part of your sleep cycle, it's been proven to be very, very beneficial for your health, for your sleep quality as well. And just, having a schedule helps to set your circadian rhythms and really learn those optimal rest patterns. So allowing the body the time to do the blood sugar regulation and increase our cognitive abilities throughout the day, because a lot of cognitive processing happens during our sleep. Memory and attention, they are all affected in the day based on the quality of sleep we're able to get. So that's why it's so important. Intermittent fasting is something that I absolutely love for a number of reasons, but I like to talk about it in regards to sleep just because, with fasting, you have an eating window and a fasting window. And during the fasting window, that really allows for us to get into a schedule with not only our digestive system, but with our sleep schedule. It's easier for us to fall asleep. We sleep better when we're not worrying about digestion, as I mentioned before. And so, getting into that pattern of cutting off certain hours before bed and, kind of breaking our fast at a time that's consistent with our circadian rhythms and our digestive functions can really be beneficial as well for our sleep. So there's different types. You can do the 14-10, 16-8, or 18-6. All that means is you would be fasting for 14 hours of the day, for example, and you would have a 10-hour eating window where you would be able to eat your food. And conversely, 16 hours of fasting, 8 hours of eating, or 18 hours of fasting and 6 hours of eating. So depending on kind of where your metabolism's at, what you feel like you can actually accomplish, and based on like your health as well. Not everyone can do intermittent fasting. Some people that have things like diabetes, for example, it might not be the best idea. But if you have like insulin resistance, where you're not diabetic, but you're trying to help your metabolism and help your blood sugar regulation, intermittent fasting has been shown to really help with that. So as it says here, some of the benefits are insulin resistance, glucose levels, they get improved, or your lipid levels improve. It can help regulate your blood pressure if you have hypertension. It's great for weight issues. If you have obesity, for example, it's helping with our metabolism, obviously, and it's also helping with a lot of inflammation because during that fasting window, we're giving the body an opportunity to decrease a lot of inflammation. And so that's why it really can help with things like osteoarthritis or rheumatoid arthritis, things like that, those inflammatory conditions. But you'll only see the benefits if you do this properly. I never recommend pushing your eating window close to bedtime. That kind of defeats the purpose. You don't want to do that. And you don't want to just binge out during your eating window either. That's another big point with intermittent fasting. It's not like you should just eat whatever you want during your eating window. You still want to be focusing on those nutrient dense foods and make sure that it's going to be of benefit to your system, right? So those are just some points on intermittent fasting. Next, exercise. Exercise has been found to increase the length of our deep sleep. So I didn't really go into this much during this talk, but a previous talk I did, I was talking just about sleep hygiene and our sleep cycles. And so what happens through the night is there's 4 stages of sleep. First 2 stages are kind of like your light sleep. Stage 3 is your deep sleep, and stage 4 is your REM sleep. And stage 3 and 4 is where a lot of the really important processes have to happen in the body. And so you want to make sure that you're getting a lot of that deep sleep. And that's what exercise helps to increase the length of those cycles. It can also help improve things like anxiety and depression, which often do impact sleep. As we mentioned before, the antidepressants that also can help with insomnia, the reason that drug is, there is because insomnia and depression, they often go hand in hand. And so by just doing exercise, sometimes you can really help with those conditions and therefore hopefully decrease the amount of sleep issues you have. Causes changes in core body temperature. So, you do want that increase in your core body temperature during the day. As a part of that circadian rhythm, that naturally does happen at some points. It's just at night when we want it to kind of cool down, but that fluctuation is very good for us too. And it also may help realign your circadian rhythms. So exercise is a great, obviously for a number of different reasons, not only for your circadian rhythms, but other health reasons as well. Time outside. Time specifically in the morning really helps to set your circadian rhythms because if you remember from the image again, at 7:30, that's when our melatonin production is supposed to stop. And one of the main signals for that is light. And sunlight is one of the great ways to help our melatonin production stop and get us going for our day. Vitamin D is also an essential nutrient for sleep. So sometimes if you have poor sleep or if you're having sleep issues, you could potentially even have a vitamin D deficiency. Exercise, going for a walk or run outside, spending time in nature to relieve stress and anxiety. These are like multifactorial activities that are doing a number of things all at once, so time outside is always excellent. Now, here are some different medical recommendations. We have to get to the root cause of your sleep. When we were talking earlier on in the presentation about the different causes and the different conditions associated with sleep issues, we really have to figure that out first so that we know how to base our treatment. Poor sleep could be due to a number of things such as mental emotional issues, anxiety, depression, as we've mentioned before, past traumas from things like loss, divorce, or abuse could also be playing a role. Stress is a huge part of poor sleep because when cortisol is increased or epinephrine, a lot of these stress related hormones, they really can affect your ability to fall asleep and stay asleep. So stress from work, school, family, or relationships, they could all be playing a role. Different life circumstances, if you work late shifts, if you're a caregiver, those can all kind of impact how much sleep we're able to get, the quality of sleep, especially if it's kind of disjointed if you're a caregiver, for example. Um, but yeah, we have to try and work around those different life circumstances and do the best we can to try and regulate our circadian rhythms to not be as affected by, you know, not being in alignment with it. And then we have to find out if there's any other underlying health issues like those sleep disturbance conditions we talked about or other health conditions. Supplements. So talking back to the pathway image that we showed of melatonin production, right? A number of the things included there were our vitamins like vitamin B6, folic acid, and some of our minerals like iron, calcium. So that's why a great high quality multivitamin slash multi-mineral is really important to have on hand first, so that you kind of get all of those in one, right? Then we talked about essential fatty acids. Our omega-3s are really important for sleep as well. 5-HTP comes as a supplement on its own. Remember, that's that precursor before serotonin, which then produces melatonin. We have melatonin here in various forms. There are sublingual tablets you can take. There's a spray that I really like that has great absorption, and capsules. And then L-theanine is another amino acid that's really great for sleep promotion. Next, the botanicals. This, I think, people are very familiar with, especially the top one, which is chamomile. Now, some of these are color coded, and what the color coding means is that green is for the more milder cases of sleep issue. Yellow is kind of a little bit more of an intense issue, and then the red are our highest, I guess, if you struggle with sleep the most type of thing. Those pack kind of the heaviest punch for helping with sleep promotion. So chamomile is really great for reducing nervous tension. So people that are very agitated and restless before bed, chamomile is excellent for that. Chamomile has this antioxidant in it called apigenin that really helps promote sleep, and it also has GABA naturally. GABA is that neurotransmitter we talked about as a part of the benzodiazepine family of drugs. So it kind of has that same neurochemical reaction of gamma promoting that kind of relaxation. Lavender is great for people with a lot of anxiety and that have a very overactive mind. So if you kind of have those racing thoughts before bed, that kind of is what's preventing you from falling asleep, lavender may be the herb for you. Either in the essential oil, under your pillow, or having it in a tea somehow. Next, we have lemon balm. Lemon balm is great for those that struggle with depression, anxiety, or that have stress-induced migraines. So if you struggle with any of those things, lemon balm can be helpful, but you also want to remember that lemon balm can be virosuppressive. So if you already have hypothyroidism, you might not want to be having lemon balm too often because it could be decreasing your thyroid hormone even more. Next is passion flower. Passion flower is a lovely herb. It's great for people with those cyclical thoughts at night, and those that are very depleted and exhausted. This makes me think of just your very high stress work job, where you have kind of a lot on your plate. Passion flower would be a very nice herb to try to help with sleep. Next are yellow. So we're increasing it a little bit, right? Skullcap. So skullcap is great for weaning off of sleeping pills. Those that are kind of fearful, that have restless sleep, and that may have muscle spasms during the night as well. Skullcap can be great for addressing that. Hops. Hops is great for those with a lot of anxiety, worry, indigestion, and for hot flashes. So people that are, perimenopausal, postmenopausal, that are experiencing hot flashes, hops is a great herb to have on hand, because hot flashes is a huge reason for a lot of poor sleep issues or poor sleep. Kava kava. So this is, that's one of our higher severity ones. So it is great for chronic anxiety, and for those that can't relax to fall asleep. Kava kava is very, kind of sedating like that. And so it's really, it's potent, it's potent. But again, I want to warn that you don't want to be on it for any prolonged periods of time, and you don't want to take too much of it because it can potentially be hepatotoxic. Then we have valerian. Valerian is quite a potent sleep herb as well, but it's usually not like in a dangerous way type of thing. It usually improves the total sleep time you're able to achieve, and it usually decreases the time it takes for you um, to fall asleep. Yes. And it also decreases the frequency of awakenings. So valerian kind of puts you into a nice deep sleep. It's really excellent. Okay, and this is the last section, therapeutic recommendations. So stress management techniques can be a great way to help manage your sleep and improve your sleep, because the root of a number of sleep issues is usually stress, prolonged stress, or possibly, a past trigger, a past really stressful event that you just have never gotten back to a good sleep routine since. And so really addressing your stress can help address your sleep. So first is the deep breathing techniques. I really like box breathing. Box breathing involves the 4-4-4-4 method, wherein you inhale for 4, hold for 4, exhale for 4, and then hold for 4. Next is alternate nostril breathing. So you kind of breathe all the way out through your nose. You cover one nostril and you breathe in. Cover the other, breathe out. And breathe in and out. So you kind of just go back and forth, getting the air flowing through each nostril. And the 4-7-8 method is where you inhale for 4, hold for 7, and then exhale for 8. So all of these different deep breathing techniques, I recommend for anybody that has a lot of stress or anxiety, that has trouble falling asleep. You do this for about 2 to 5 minutes before bed, and it can really help you get some good quality sleep. Mental imagery. Mental imagery is a really great technique wherein you kind of imagine or visualize things in order to get through sort of what's happening in your day. So for example, you kind of imagine, all the stresses or all the problems from the day, and you kind of imagine it maybe being collected in a balloon, right? In a helium filled balloon. And then you imagine letting go of the balloon and just watching it float away, for example. I don't know. I just made that up off the top of my head. But imagery can be a really great stress management technique, just because it's like you're physically seeing those things go away and you're just allowing it to pass. And then once it's moved out of your, out of your mind, then you can get into sleep, being a little freer, a little more relaxed. Muscle relaxation is kind of another activity you can do. So what that entails is, kind of, you can close your eyes and imagine tension in different muscle groups, but you're isolating the muscle groups as you're doing it. So, for example, if you close your eyes and say, clench your fists as tight as you can, and then relax them completely and relax those muscles fully. Then, you can move up to your shoulders and like clench or tighten your shoulders as tight as you can, and then relax them. And you kind of go through different muscular systems in the body, and throughout the process, and by the end of it, your muscles and your whole body should be in a much more relaxed state. Then last is just journaling. I kind of touched on this in the beginning, wherein you can write down what happened in the day. You can do a gratitude journal. You can kind of do whatever is going to mentally free you up enough to fall asleep, pretty much. So that's one of the benefits of journaling. Now, cognitive behavioral therapy, this is huge, and this could be probably a whole webinar on its own, honestly, because this has been the most effective thing researchers have found for chronic insomnia. It has a 70 to 80% effectiveness for people that struggle with true chronic insomnia. Because they found that the drugs are good acutely, like for short amounts of time, but not for chronic insomnia. So things that are lasting like 3 months or more. And what it requires is you keeping a sleep diary to really track your sleep-wake patterns. And through the process of tracking these things, you will slowly and very intentionally start seeing the changes in your sleep as you employ these certain techniques in regards to cognitive behavioral therapy. So cognitive activities before bed each night that aid in sleep are things like the journaling and the deep breathing and the imagery that I was explaining before. So in this sleep diary, these are some of the things that you're kind of recording. You record the time you went to bed, the time you turned out the lights after, when you actually fell asleep, and like how long it took you to fall asleep. Then you have to, in the morning, you quickly jot down, you woke up how many times during the night, the total duration of these awakenings, which can just be, an estimation. And then after awakening for the last time, I was in bed for how many minutes. So all of these are important key parts in our sleep throughout the night that, if we track it and kind of become more aware of it, we can help address them based on certain activities that we do either during the day or right before bed. And then lastly, I got up at this time. Then you have to then rate your sleep quality on a scale of 1 to 10. And then there's other things you have to record as well, such as the number of naps you took, if you drank alcohol, if you used any sleep medications and what dose, and then any additional notes on your symptoms. So a really great book for reference is Sink into Sleep, a step-by-step workbook for reversing insomnia. She kind of really walks through an excellent cognitive behavioral therapy approach specifically for insomnia that this book kind of outlines, which is what I'm adapting this information from. So that is our whole talk, but here are some of our upcoming events and announcements. So in March, we had our monthly newsletter. We also started Sister Doc Talks. Episode 1 is now streaming on Spotify, so you can listen to that. And we still have our group medical appointment survey up on the website. If you can go on to i2healthclinic.com and fill out the group medical appointment survey, that would be very beneficial to us and then beneficial to you, because we are just trying to pull your interest and make sure that we're catering this to what you all need. In April, registration for our Walk Water Wipeout Challenge starts. And it's a really great fundraiser. We're partnered with the L.W. Mitchell Foundation to raise funds for a school in Jamaica for elementary students. And we are doing this challenge that everyone is invited to participate in to help build that school. You can go to our website and the L.W. Mitchell Foundation in order to find out more on that. We also have a new blog post on our website for April, and it will be talking about sleep, kind of some highlights from this talk. And then the newsletter will also be released in April. Now for May, May 15th is going to be actually when the Walk Water Wipeout Challenge begins. And it's going to be a 2-week challenge where essentially we're challenging ourselves to increase the amount of water we have, increasing the walking that we do, and wiping out certain junk foods for those 2 weeks. And it's a fundraiser that we did last year for the first time, and this is going to be our second one that we run. And it was a really great experience for everyone that participated. Everyone saw really great improvements in their health, and you're also helping a great cause. So our next free webinar will be May 15th, 2022 at 7 p.m. And that is going to be in conjunction with the Walk Water Wipeout Challenge. All right. And again, if you have any questions or if you really want to try and get to the root of any sleep issues you may be having, feel free to book an appointment with me at Integrative Interactive Health. There's all the information for you. And I hope to see you soon at our next talk in May. Thanks, everyone, and have a great day.